Hello doctors, I am your med buddy Arun and I welcome you to my first lecture of series on anatomy. In this lecture, I will take you through the blood supply of head and neck region, all the major arteries, their branches, their supplies, their relations, and finally the flow chart giving a summary of all these arteries. So let's get started. The very first artery of the body arises from the left ventricle, which is the aorta. Aorta, as it arises from the left ventricle, moves upward forming an arch right behind the manubrium of sternum. At this level, it forms an arch, and while forming the arch, on the right side, it gives brachiocephalic trunk. This brachiocephalic trunk gives an artery which is called the common carotid artery and another artery which is called the subclavian artery. This common carotid artery is arising on the right side at C7 or thoracic 1 vertebrae posteriorly and anteriorly at the level of sternoclavicular joint. After that, the subclavian artery, which is divided into three parts. From the very first part arises the internal thoracic artery, the costocervical trunk, and the thoracocervical trunk, and the common carotid artery, and posteriorly crossing the vertebral artery, which is shown here. Common carotid artery arising from the sternoclavicular joint, it moves upward and it moves within the carotid sheath, which is the combination of three fascia, which I will tell you later. Within the carotid sheath, it also has relation with internal jugular vein on its lateral side. Between internal jugular vein and the common carotid artery moves the vagus nerve, which is in the middle and the posterior level. After moving right at the level of C3, C4 posteriorly and at the level of upper border of thyroid cartilage anteriorly, it divides into two arteries, that is external carotid and the internal carotid. Right at the bifurcation, there is a very important organ which is called as carotid sinus and the carotid body. The significance of this organ will be taught you in later lectures. Now the relationship of this common carotid artery with other organs. The common carotid artery moves on the medial side. It moves along the medial side of the sternocleidomastoid. What is this? Sternocleidomastoid is one of the very important muscle on the neck, which is lying right here. You can see this. It is the sternocleidomastoid, and right here common carotid artery is moving. This artery is crossed from medial side to the lateral side by a very important muscle, which is a small muscle but important. This is called the omohyoid. It is basically crossed by the tendon of omohyoid. And other muscles such as these are called the strap muscles, which are sternocrcoid, sternothyroid muscles are lying posteriorly and in the medial region of this common carotid artery. Common carotid artery is also crossed from anterior lateral to the medial side by ansa cervicalis. Ansa cervicalis is also called the cervical outflow. So these are the relationship of common carotid artery. External carotid artery. As common carotid artery bifurcates into two arteries, external carotid and the internal carotid, the external carotid artery starts moving more laterally and superficially comparatively to the internal carotid artery. It moves upward and reaches right behind the ear, and here it reaches between the mastoid process, this is the mastoid process, and the styloid process. It moves above the styloid process and below the mastoid process and enters the parotid gland. Enter the parotid gland, and it enters the region of face and gives arteries, branches of arteries, which we will talk further in the lecture. While the internal carotid artery moves more deeper and medially it reaches below the styloid process right here, and then it enters the carotid canal. After entering the carotid canal, it enters the petrous part of the temporal bone. Here is the petrous part of the temporal bone. Then it moves into the cavernous sinus. Right after exiting from the cavernous sinus, it gives several branches that supply the brain. Now let's talk specifically about external carotid and the internal carotid artery. Within the neck region, common carotid artery does not give any other branches generally. The external carotid artery, which is crossed by the posterior belly of digastric, in relation to it, the posterior belly of digastric muscle crosses it from lateral to medial side, while other muscles such as hyothyroid and other strap muscles lies medial to it. The branches of external carotid artery. The very first branch of external carotid artery is the superior thyroid artery. It gives some muscular branches and glandular branches. The very first muscular branches are the infrahyoid, sternocleidomastoid, mylohyoid, and cricothyroid branches. These are the muscular branches. These branches supply their specific muscles, and the cutaneous and the fascia around those muscles are supplied by these artery, while the main branch, that is the superior thyroid artery, it originates right after the bifurcation. It crosses over the common carotid artery, it moves along the strap muscles and reaches the superior border of the thyroid gland, and it is supplying the superior border of the thyroid gland and also the larynx. The second branch of external carotid artery is the ascending pharyngeal branch. Ascending pharyngeal artery, it gives three branches: the meningeal artery, branches of the meningeal artery, and this supplies all the nerves which are coming from the foramen lacerum. Another is the inferior tympanic artery, it supplies the medial wall of the tympanic canal, and other branches are the pharyngeal artery branches. These are small branches which supply the wall of pharynx, palate, tonsils mainly. Next is the lingual artery, which gives three branches, that is the sublingual, dorsal lingual, and the suprahyoid branch. These branches supply all the region of the mouth, that is the soft palate, tonsils, and the tongue, mucosa of the tongue, and the suprahyoid branch, it supplies the floor of the mouth, that is the mylohyoid muscle. Another is the occipital artery. This gives two branches, that is upper and the lower branches. The lower branches goes back and supply the neck muscles, while the upper branch supply the muscles in the auricular and the occipital region. Next branch is the facial artery, which is the longest branch, and it originates at the level of greater cornu of the hyoid bone. It originates from there, it moves deep behind the digastric muscle, and it reaches up to the mandible at this point, and from this point it enters into the oral cavity and reaches the submandibular gland. There it gives the glandular branch and it supplies the submandibular gland. It moves further, giving the tonsillar branch, which supply the tonsils. It moves further, giving submental. Lastly, it gives the ascending palatine branch, which supply the soft palate and the hard palate. Next, it gives the posterior auricular and the superficial temporal branch. These arteries give several branches which supply the muscles of the temporal region and muscles in the parietal region. The last branch, after entering the parotid gland, it is the maxillary branch. Maxillary artery, it gives branches arising from the three parts of the maxillary artery, that is the superficial alveolar part, the inferior alveolar part, and the middle meningeal part. It gives several branches and supplies several regions in the face and the head region. Now the internal carotid artery. Internal carotid artery, right after exiting from the internal carotid canal, the cavernous sinus, it gives main branches that are the anterior that is the anterior cerebral branch, the middle cerebral branch. The anterior cerebral branch moves along the corpus callosum, and posteriorly it anastomoses with the posterior cerebral branch of the bacillary artery. The middle cerebral branch, it is the largest branch of internal carotid artery. It supplies major portion of the head region. It also gives two small branches that are, one is the ophthalmic branch and another is the choroid branch. Ophthalmic branch moves further and gives two more branches that are the trochlear branch and the infraorbital branch. Now let's talk about the blood supply of the brain, in which the major role is played by the circle of Phyllis. How is it formed? The vertebral artery, as it arises on the right side from the subclavian artery and also from the left side from the subclavian artery, first part of the subclavian artery, it moves along within the transverse process of all the cervical vertebrae except the seventh cervical vertebrae. It moves up and it enters the foramina magnum. Right after entering the foramina magnum, it gives the very first branch, that is ICA, anterior inferior cerebral artery. Both the two vertebral artery, after moving into the foramen magnum, they merge together and form the bacillary artery. Before the bacillary artery gives some more branches in the pontine region and supplies the region of pons. Bacillary artery then gives pica, that is posterior inferior cerebellar artery, and right before ending into posterior communicating artery, it gives posterior cerebral artery that supplies a significant region of the cerebral cortex. Okay, the internal carotid artery that has already given the anterior cerebral artery. This anterior cerebral artery moves further and combines by the anterior communicating artery. From the arch of aorta on the left side originates the common carotid artery and the subclavian artery. The branches of common carotid artery are external carotid and the internal carotid artery. External carotid artery divides into superior thyroid artery, which further gives branches such as mylohyoid, cricothyroid branch, sternocleidomastoid branch, superior laryngeal, and the inferior hyoid branch. External carotid artery then ascends and gives ascending pharyngeal artery, which is giving further branches such as pharyngeal artery, inferior tympanic artery, and some meningeal branches. External carotid artery also gives lingual artery, which gives suprahyoid branch, dorsal lingual branch, and the sublingual branch. The next branch is the occipital artery, which gives some upper branches and the lower branches, supplying mostly the muscles of temporal region and the parietal region. It gives posterior auricular artery, which gives some muscular branch and auricular branches and occipital branches, which also supplies mainly the muscles of this region. It gives facial artery, which is the longest artery moving deep along the digastric muscle and entering through the mandible. It gives submental, glandular, tonsillar, and ascending palatine branch. Let's see the anastomosis of these branch. The dorsal lingual branch of the lingual artery anastomosis with the submental branch of the facial artery, while the next branch is the superficial temporal branch, which gives many branches such as transverse facial, auricular, zygomatic orbital, middle temporal, frontal, and parietal branches. These are again the branches of the facial muscles mainly. The next branch it gives is the very important branch, that is the maxillary branch. It is divided into three parts, that are middle meningeal, superior alveolar, and the inferior alveolar. The middle meningeal branch does not give any significant branch. Superior alveolar branch gives infraorbital, buccal branch, posterior SAL and anterior SAL, that is posterior and anterior superior alveolar branches. And then it gives the sphenopalatine and the greater palatine. From the inferior part, it gives the lingual branch, mandibular branch, mental, and some muscular branches. The muscular branches of it anastomosis again with the submental branch of the facial artery. Of the internal carotid artery are divided in three parts. The one arising from the petrous part are the corticotympanic artery and the pterygoid artery. The branches arising from the intracranial part are the anterior cerebral, middle cerebral, ophthalmic, and anterior choroidal branches. These anterior choroidal branches supply to the choroid plexus. The anterior cerebral branch further gives the cortical and the central branches. The other branches are coming from the subclavian artery. This artery gives the costocervical trunk, internal thoracic artery, which gives anterior intercostal branches, and the vertebral artery, which forms the basilar artery, giving finally the posterior cerebral artery. It gets communicated with the internal carotid artery by posterior communicating artery, and within the circle of Willis, internal carotid artery then gives the anterior cerebral artery, which are combined by anterior communicating artery and forming the circle of Willis. The last trunk is the thoracocervical trunk of the subclavian artery. It gives inferior thyroid arteries, suprascapular artery, and the superficial cervical arteries. The branch muscular, ascending cervical, inferior laryngeal, and the pharyngeal branches. The ascending cervical branch then gets anastomosed with the pharyngeal artery of the ascending pharyngeal artery. Thanks for watching.